Welcome to the RCM Ladder. We dive into career development and growth for revenue cycle professionals, helping you level up your career one episode at a time. This episode of the RCM Ladder is brought to you by our good friends at the Health Exchange. They are building an awesome community of revenue cycle professionals with the knowledge, insights, and resources needed to navigate the ever-changing landscape of healthcare reimbursement. The team at the Health Exchange have awesome content and events tackling everything from denials management to revenue integrity, patient access, and the importance of leveraging RPA or AI in your operations. The content is so useful, so smart, so impressive, so collaborative. Honestly, it makes us jealous. So go check them out now, right now, and then come back to us. You can find them at healthexchange.io. That's HEALTHXCHANGE.io. And now on to this week's discussion. Hey, what's up, everyone? I'm your host, James Furbush. Welcome back to this week's episode of the RCM Ladder. So excited to have my guest on this week. He is Fareed Aziz. He is the Vice President of Revenue Cycle Management for the Marshall Health Network in West Virginia. Fareed, thank you so much for joining the show. I'm super excited to have you on. I think this is going to be a great episode. So thanks for making the time.
Thank you, James.
Yeah, so I'd love to start. Can you give people just a quick overview of like Marshall Health Network? We'll start there and then, we'll go from there.
Sure. So we are an academic medical health system in West Virginia, and it includes 4 hospitals with almost 900 beds and employed physician practices of the hospitals. We are committed to improving the health and lives of over 1 million children and adults in 23 counties in West Virginia, Eastern Kentucky, and Southern Ohio. And that's about it for Marshall Health Network.
Yeah. Are you responsible for the entire revenue cycle operation at Marshall? What's sort of under your purview?
Yeah. So I oversee the ambulatory and acute front, mid, and back end revenue cycle for Marshall Health Network. So all departments.
Nice. All right. Well, I want to start because when we first talked, I love the story of how you got into revenue cycle, which is very different and very cool, starting from when you were a little boy growing up in India. So I'd love for you to just tell people the story of how you ended up in revenue cycle. It's very different from what a lot of people, the story of a lot of other people who end up in revenue cycle in your position.
Yes. So India, and especially Hyderabad, where I come from, is considered to be an IT hub. And you could readily find any multinational company, providing services to US and UK clients. And most employees would have to work in the night shift. So with that, the companies provide transport for safety purposes. As growing up, I remember clearly 15-year-old completed just the high school. And I used to observe a lot. I do that today too. I noticed Deloitte, and I didn't know anything about Deloitte at that time. I noticed that this company maintained a brand. They always had a white SUV of a specific make and model with a big Deloitte written on it. So I noticed that they differentiated themselves from others and maintained a brand. So that just stuck with me. Fast forward, after completing my graduation, I joined an organization where I sold timeshares for a little while. And yes, I'm one of those representatives probably called you and bugged you and tried to sell you a timeshare. And soon after that, I learned where Deloitte is located. Until then, I didn't even know where they were located. So I went for the interviews. There were 5 rounds of interviews. I had no idea what I'm going to get into. All I wanted to do is be part of an organization that maintains a brand. So I accidentally got into revenue cycle because they were recruiting for their RCM thread, and learned ABCs of healthcare and never really looked back. I really enjoy revenue cycle. The complexities of that really kept me grounded. I really enjoy what I do. That's my journey of revenue cycle began.
Yeah. And from Deloitte, you ended up then coming to the US. You ended up at, I think it was like Trinity you had mentioned, right? You were at Trinity for a while before Marshall Health Network.
Yeah, Deloitte sent me to US a couple of times to represent them at the client side. I actually worked and did quite a bit of consulting with them. And after that, I joined Spectrum Health. It's a large healthcare organization in Michigan now, Coral Health. And after that, I joined Tenet Healthcare. So I worked with the for-profit organization before I joined Trinity Health. So that was my last stop before I joined Marshall Health as a VP of Revenue Cycle.
I'm kind of curious as you sort of think about the sort of arc of your career so far, coming from India, Deloitte, the consultant world, for-profit, nonprofit, now academic medical center. Are there any sort of threads, like any skills and things that you've learned or that you've observed that help people for sort of building that culture of excellence in revenue cycle? Like, what makes good revenue cycle teams work?
Yeah, that's a really good question. So top on my list would be continuous learning. This may not be a skill, but as you know, healthcare is a heavily regulated industry and an ever-changing environment. So in order to build a culture of excellence, you must invest in continuous learning. And that follows with continuous improvement, right? You must continue to challenge the status quo and continue to improve the processes. And I think analytical skills plays a big role. And as a leader, you must empower your team, equip them with the tools that they need to be successful, and then hold them accountable for you to build a culture of excellence in revenue cycle.
How do you do that as a leader? How many people do you have on your team?
Oh, more than 500 colleagues overall, indirect reports. So it's a very large team. And I think you lead by example and you show that you really just leave where is needed and you guide your team where the guidance is needed and you let people learn and try different things and fail when, a lot of times we hesitate and we don't want to fail. And sometimes those were the biggest learnings in your life when you try something new and fail and you try again. And that's what gives your team confidence. And I don't like to micromanage, although I can be one of the worst micromanagers you could have if I have to be. But my style is more to empower, know your team, put them in the right place, right? Because it's very important. We all bring a unique skill set to the table. So understanding your team, placing them in the right seat on a bus makes a big difference. And then empower them, make sure that you give them all the tools and you guide them and uplift their confidence. And I think once you continue to do that, you will see the trickle down effect because they will then work with their colleagues, make sure that they're providing the same environment for them to grow. And that really helps you build an excellent team in terms of a high performing team.
How do you figure out where to be hands off and like where to micromanage? I always feel like that's got to be like such a hard thing for a leader who it's like you're trying to empower your people. And the best way to do that is be hands off and in some ways let them figure it out. On the other hand, you get to where you are because you're very good at what you do. It's a little bit like I could just do this better probably than maybe some other people. So how do you find that line between empowering teammates and knowing when to step in and take over, for lack of a better way to put it?
Yeah, absolutely. So it really depends who you're working with and where they are in their careers and what do they need to be successful, right? And then it's more so show and tell. So currently we are in a process of implementing EMR at one of our hospitals. I'm one of the sponsors of the project and I'm not as involved daily in that project. I let my leaders lead. When there's an issue and there's a roadblock, I get involved. But prior to that, we had an optimization project. And my team prior to that really did not have much experience in implementing systems. They have had one occasion where they had to do that, but really not thorough in that process. When it comes to the optimization project, I was hands-on, show and tell, right? How do you have those conversations? I mean, there's a lot of things that you have to do. I mean, implementing a system is not an easy task. And optimization was also a big project for us. It took a year. So I was very engaged. They've seen me in action. They saw what I've done and how I handled it. And then you let people continue to take that from there, take the baton and move on. Now they're doing a great job making sure that they are engaged. They are making the right decisions and where they need to ask and escalate, they do so. So I think it's more of a show and tell where needed. Now, some colleagues may not even need, they already know. Then you become a cheerleader. You cheer for them and you give them enough opportunities so they can succeed. If they're early in their careers, obviously a lot of that handholding needs to be done initially and motivation. They will take it from there. If you're already in a role and have been doing this for long, as long as you're wired in a way that you expect and it helps you overall, then you let them just take it on and you help them, coach them, right? The coach is not on the ground playing with the team. They're coaching, they're providing the feedback. So you have to really feel very comfortable when to be a coach, when to be really hands-on, where you're actually showing how to kick the ball, in other words. So really understanding your team is the most important part of all of that.
Yeah, that's so awesome. And so in understanding your team as a leader, do you have some approaches for how you go about, is it just like getting to know people as you get to know them? Do you have sort of a way that you really dive into sort of understand your team, your people, your direct reports and people like that?
Oh, absolutely. So anytime I take a new role, the very first mission critical for me is to understand my team, my direct reports, understand the gaps in the processes, and understand who have the skill set and where they're at. So I really invest time. I sit with them, I meet with them, I interview them, I ask questions to understand where they're at, how they think and how they perceive to be, what's their vision, what are their goals, and how do they think? Well, what are the challenges and how did they handle it before? So this is a very integral part of any role that you take as a leader, making sure you understand very well. So I invest a lot of time in the first few months to sit with each of them, understand them. And then once I have a good understanding of the players and the game itself, right? Because every hospital is different. The challenges are different. You must understand the challenges. You must understand the playing field so you are able to support your team well. So that is what I really make sure I do in the first 3 months of any role that I take.
Yeah, that's awesome. I mean, it's so important. That is like, here, no hospital is this. I mean, they're not, right? It's like every organization has their own challenges with patient populations and all sorts of things. I want to jump back to something you kind of mentioned, talking about motivating your team. You have a really fun story about motivation. I'm going to make you tell it. Is talk about what you have learned about how to motivate people on your team to get the most out of them.
Yeah. So what I believe is really there's no magic pill when it comes to motivating people. You really need to put an effort to learn what really motivates them. Because what could motivate me may not be the same what can motivate someone sitting next to me. We leaders, with all good intentions, we come up with great plans of how they're going to motivate, but fail to ask the people who you're trying to motivate, what works for you? What would you like to see? What motivates you, right? Those are the key elements that we tend to miss with all good intentions, by the way. So a funny story that I think I shared with you before is in one of my leadership retreat meetings, I think it was last year, I asked the leaders, hey guys, what motivates you? What would take you from point A to point B? What makes you excited to get up in the morning and do what you do? And by the way, so next year it'll be 20 years of my leadership experience. Okay. So I thought I know all about motivation. I thought I did it all. I know it all. I can write a book. Out of nowhere, something unique has, been expressed, which took me by surprise. It was, basically the leader said, Farid, anytime when we break a record, we want you to take the pie in the face. That'll excite us. And I was like, oh, that's interesting. That's different. Never heard of it. So I said, let's do it. I promise I will do that. Guess what? The very next month, they broke the cash record. And I totally forgot about my promise. And one of the leaders reminds me, do you remember your commitment? I said, what are you talking about? Well, anytime we break a record, you take a pie in the face. I said, oh boy, yes, I did. Let's do it. So in one of the staff meetings, we made that happen. And I think there's a video on LinkedIn. By the way, James, the team has actually exceeded, broke their record, collections or any of the metrics at least 4 to 5 times. You just need to understand what really and make it fun. That's one thing that I always say to people. Revenue cycle, yes, it's very complex. It could be overwhelming, but you can make it fun. We have fun Fridays on every Friday where we leave the work aside. We spend half an hour quality time with each of our colleagues to just do something different, get to know each other. A lot of times we spend years with someone, working with them, and we don't even know how many kids they have, what they do, where they go. And that's a shame. Yes, it's a challenging role. Yes, it requires and demands a lot. But you know what? We are first human before anything else, before our titles. The more your leaders, your colleagues get to know you as a leader and understand that you are a person behind that title, you have the same urges, you have the same motivations, you have the same goals, then people can really relate to you as a leader a lot more. So I spend a lot of my time with that too, with my direct reports, even in my one-on-one meetings that I have on a weekly basis. We start off with something personal or try to get to know each other. We try our best. It's not always possible, but I always keep that in mind that you need to know a person at a personal level for you to be able to help because you wouldn't know how to motivate them.
How many pies have you taken in the face now at this point?
So, that's an interesting question. So I'll tell you, it went so successful the first time and people had a blast. They even had oh my God. So this is how they did it. Okay. They actually put all the names in a pot to select the person or to shortlist someone who would actually do the honors.
Oh, it's like a lottery to pie you.
Oh yeah. So they didn't know what they were being nominated for. Oh, one of the colleagues, was nominated. She was like, okay, here's the pie. You do the honors. And she's like, oh my God, I can't do that. I said, no, go ahead. And they never did that before. The leadership before me was kind of old school, in other words. And we really tried to break that. And we said, no, you can have fun while, working and you can have fun at work. So I'm sorry, what was your question?
How many pies have you taken in the face?
Yeah. So I took one. And then my leaders got excited. So my directors took it in
the silly string.
Yeah, the strings. Yeah. So basically 8 or 10 of them, they had those outside. We did this outdoor with activities. So they're coming up with different ideas, not just a pie. So one time we did that. And then the other time it was something else. So my leaders took it. So my director took it, then manager took it, and my other supervisors took it. So we're making it more fun. And they understood. Before that, they never really had these kind of things. So they understood, you know what? This makes us more personable to our colleagues. And I think we should have more fun. So, yeah.
There's probably like an element of team bonding too.
Oh, yes.
There's something that brings people together about shooting silly string or throwing pies in the face.
Absolutely.
That brings the team together.
And they felt more comfortable reaching out. Otherwise, in the past, talking to a VP of revenue cycle was overwhelming for some of the colleagues. We broke that barrier. I remember one of the colleagues actually came, and mind you, I have 3 offices. So I'm not always at the same location. So they hardly see me. And if they see me, I'm on calls. So I hardly get the opportunity to talk to the colleagues. And one of them, not too long ago, came and they wanted to introduce a new colleague that has recently joined. And in his introduction to me, he said, this leader has changed the atmosphere at work. And I was thinking to myself, I hardly meet with the colleagues, but those moments, the staff meetings, or the once in a month, just that appearance and being consistent in your message makes a difference. And then your leaders will take it from there. You build the culture, you shade how you want the team to function, and you led by example, you showed how to be done, and then your teams will take it from there and build upon it. And that's exactly what has happened.
Yeah, that's amazing. I could talk about pie in the face all day, but we'll switch gears here for a second. I'm curious for you, for so many people, probably getting to that level of VP of Rev Cycle probably feels like quite the apex, right? Of your career, like a lot of people build to that level. But I'm curious for you, do you have sort of a vision for how you're thinking about your career, what comes next, how you're thinking about 5 years, 10 years down the road for just sort of that sort of career journey that you're on?
Yeah. So I was very strategic, even though I didn't know that I was being strategic, to be honest, early in my career. One thing that I've always done is investing in myself, learning more, taking on challenges, doing something different. I get very uncomfortable when I start getting comfortable in a role. So that has always been my case. And my wife don't like that because she's like, how many times you're going to take a role and do something different and then My resume and my profile probably talks a lot of that. But I really was very strategic in what I'm doing and what I'm learning. I didn't care about what I make because I know you can make it. There'll be a time you'll make. It should never be the focus on. What I focused on is what am I doing? Am I investing? Am I learning something new? If that'll take me to the next level. I didn't focus on a title because really titles don't matter much. If you have what you take, people will come to you with titles and roles that they want you to be in. Focus on investing in yourself. Make sure you're better than yesterday. Have goals, milestones. A lot of times we dream about big things and we only dream. We never have milestones how to get there. I oftentimes ask people, have you ever left your driveway without knowing where you're driving? Some people did say yes, okay? But most people say no. Why would you do that? Then I ask them, if you don't do such a simple task of leaving your driveway without knowing where you're going, how could you not have milestones and goals and in your career where you spend 8 to 9 hours or most of your day and really don't have plan of where you're going? So you got to have a roadmap. You need to know where you're heading, what you want to do. So I focus on investment in myself and learning, and jobs and opportunities came to me. There was a time I always tell my team, nobody cared who Fareed was. But as you invest in yourself, then people want you in your team because you invested in yourself. If someone has $10,000 and don't know anything about stock market, if I tell you Tesla and if I tell you ABC organization, mind you, they may be the best, they're doing really well. But if I ask you if you have $10,000, who would you invest in? You will say Tesla because you know and you heard of. So how do you build your brand? That people know you and people can see that you have invested in yourself and it shows with all your hard work. So I think focusing on yourself and investment goes long ways. And that is what I would say. I was very open to learning something new, taking a new challenge and doing something different and asking for more. There was a time, I'll tell you, people may really love to be in this place, but I was so uncomfortable in one of my roles. I took something that was new. I've never done it. Cash posting. I've never done it. Cash posting is unique in its own. And I took a manager role and I didn't know anything about cash posting. I knew everything about follow-up and everything else in the back end, but never did cash posting. And within 4 months, we resolved all the issues that we've had. And we had hardly any unposted cash. Everything was balanced to a T. And I used to look at the clock at 3 and 2. I had nothing to do afterwards. I went and I talked to my leader and I said, look, you got to give me something more. This is not enough. I am bored. So they created a position and there was a manager who left. They were responsible for 6 hospitals billing. They said, okay, we'll combine the billing and cash posting, but promise that you stay in this role for 1 year at least, commitment to be in that one role, one year. So I did that. I took those. I enjoyed for a year. I resolved some of those issues and then on to patient access. Then I took a role as a director of patient access because I wanted to learn, because a lot of times back-end folks think that they know all about patient access. And I was one of those ignorants, okay, before I took the role. And it's very simple. Why do they always make errors? And this is a quick example. And I said, you know what? I want to be in their shoe and understand. And I took that role and I really had the appreciation for all the struggles that they go through and the amount of, the patient, facing all is always challenging. Then you deal with a lot of clinical departments and so on. So I understood while the processes could be simple, but people adds complexity to it. But learning those things helped me understand fully. And because of my back-end experience, I was able to bring a lot of value to front-end. So those things really helps. The more you learn, the more you know, the better you get. So that would be my tidbit.
I love the concept of just like invested in yourself as if like you were a stock. Give me 1 or 2 ways right now currently that you're currently investing in yourself.
Yeah. So as I mentioned, no matter where you are in your career, you always have an opportunity to learn. So I have that open mind of always open, looking to learn from anyone, whether that's your colleagues, whether that's your leader. So that's always with me and it'll always remain with me. That's always my top one. And second, exploring and understanding the market and the challenges and be ahead of it. Learning and investing some time to understand what's going on and be proactive in your strategy and vision. Have a vision for your department and strategize things. Learn what's going on and be ahead of the game. So that's something that I do when I have time, understand what's going on in the market, what's happening, how could we address it? Be ahead of the change, be the change, drive it. As they say, be the bull and chase the storm. So that's what I believe in, be ahead of the game, be proactive.
What is something, because obviously you've had a sort of a range of experiences in RCM. I'm kind of curious for you, what is sort of like the hardest thing about working in revenue cycle?
It's a complex environment, to be honest, and ever changing, but it's fun. That's what kept me in revenue cycle, to be honest, because I love change. I enjoy the complexity, but I think a lot of people may not like that because it's a heavily regulated industry, as we know. There's always something. If you take a break for 2-3 months and you come back, you'll hear all kinds of things that has happened. And that's when you realize, oh my goodness, then you realize that how quickly we move and how quickly the change. I always tell healthcare is a synonym of change. Those who don't like change, I recommend you stay away from revenue cycle.
I do think that's kind of one of the things that I love about working in healthcare. And it's probably just my mindset of like I started my career as a journalist. So it's like I love learning new things and sharing that with other people. And I feel like every time I get to a place where I'm like, oh, I finally understand whatever, like 3 months later, it's like, oh my God, I don't understand this at all. I can't even imagine, for someone like you, just trying to stay on top of state regulations and federal regulations and all of that stuff just could make your head hurt for sure.
Yeah. And when you have a good team and when you invest in the team, all of this becomes easy. Because if you're the only one who is thinking and doing all of this, then that's a very daunting task. But if you really care and you invest in your people and you bring them up, then you're not the only one who is looking and doing things, right? You can take a backseat at that time and just make sure that things are going well. So that's exactly what I do. I invest a lot in my team, make sure they're ahead of the game and they are investing in themselves. Finding those superstars is important and making sure you give them the opportunity to succeed and give them the platform. A lot of times people hesitate to do that. And I ask people, anytime I take a career, I ask my team, what do they want to be? Where do they want to be? And some of them mentioned that I want to be in your place. I said, let's go. Are you ready for the challenge? I'm going to put you through the task. And I do that because, at that time they're engaged, they want to do it and they're excited because they have the opportunity. And it becomes your job a lot easier because it's not only you who is thinking outside the box.
Yeah. What's something you wish people would talk about more in the industry, like in revenue cycle? And like, what do you think is something that we should talk more about as an RCM industry?
Yeah. So these days we're talking a lot about AI, which is great. But I think we oftentimes focus on solving the symptoms and not the root cause. Why healthcare got this complicated? Resolve that issue. Make revenue cycle simple. Focus on stricter regulations that will hold the payers accountable. The reason why it is so complicated is because there's a third-party payer, and that's not going away. It's going to only get more complicated. So I think focusing on legislation and really holding the payers accountable. Yes, there's some work being done, but not as much that is needed. Because, for example, there was a recent article, I think with HFMA, the battle of the bots, that insurance companies are using bots to deny. The response to that is, let's implement AI to respond to it. You're addressing the symptom, not the problem, not the root cause.
Right.
Right. So that's what I think.
Awesome. That's good. All right. Let's mix it up. Ready to do the lightning rounds?
Sure.
The rules are simple. I'm going to ask just a few quick questions and you just give me the first fastest answer that pops into your head. All right. Question 1. What's the most important metric that you care about that gives you the most anxiety?
So, well, this is lightning round, but unfortunately I have to give a little bit longer answer to that. So there's a lot of metrics that, we revenue cycle leaders look at. But if I have to sum it down to one that really gives a good picture of the rest, is your cash to net revenue metric. So it doesn't give me anxiety, but I like to be, around at least exceeded by 1 or 2%, which tells me that I am actually overturning the batted AR into cash. So that would be one of the, I think, metric that I would look for.
This is new to me, so I'm going to break my rule. Usually my rule is I don't ask follow-up questions to keep this going longer. So you said cash to net revenue?
Yes. So you take your net revenue into account and then you look into what cash have you collected. Because again, each month you have a gross revenue and net revenue. And we allow ourselves 60 days to actually resolve the AR. So we always have a goal. For example, for the month of July, the goal was the net revenue from the month of May, right? So if the net revenue was 50 million, I better collect 50 million in the month of July, right? So that gives you an idea that you're actually collecting and you're overturning denials. Usually you have a bad debt AR, like anything over 360 is considered to be a bad debt. 8 to 365 aging is considered to be bad debt. When you overturn that AR, it is a positive to your bottom line. So the only way you could go above 100% of your net revenue is by overturning some of that age AR, bad debt AR to cash. So that's one of the metric that really sums up to, because really there's so many metrics in revenue cycle. But end of the day, what are you really trying to do? You're trying to collect cash on all the services that you provided, the much needed services that you provided to your patients. You're trying to collect on that. So that's why I said it really sums all the efforts of revenue cycle into that just one of those metrics. And that's something I look at very closely.
I love that. That's
Right.
amazing. All right. So for you, what's the biggest goal you want your team to achieve over the next 12 months?
Yeah. So next 12 months, I mean, that's a loaded question. Let me just start with 24. I think we're very close to our year end.
Say 24, but then I was like, oh my God, it's already like August.
August, yes. So for us, our year end is September, and the team has already excelled and exceeded several of the metrics. One of the things that I really hope to accomplish is, as I mentioned to you, we're implementing an EMR at one of the hospitals. I would love for us to be able to go live this year. So that will be one of the things, balancing between the operations and implementing. And we have many other projects in play that we are working on. That's typical revenue cycle, James. You have 100 things going on, and I already have things planned for next year that I would like to accomplish. So there's a lot going on. I remember I promoted one of the leaders a long back, and he was very good in cash posting. After 2 months, he came back and said, I had to go to ER. I can't handle this. And I was shocked because things were going really well. He was used to completing his work at the end of the day and closing his shop and be done. But in leadership, you can't do that. That's never going to happen. That was enough stress in his life that he had to go to ER. And he said, I can't do this anymore. I respected his decision. He took a role, the previous role, and we moved on. What I'm trying to say is that in revenue cycle, I can sit here and tell you the next 3 to 5 years that I will be implementing things. There's always something going on. And that's what I really love about revenue cycle.
Amazing. All right. What would you say is your career superpower?
So help me understand a little bit more.
Like, what is the thing that you are like really good at professionally? That is like the thing that you lean on, the skill, the whatever. Like for me, for example, I am really good at like learning and like explaining it back to people.
Yep. So for me, it's going to be solving problems. I love taking anything complex. I get hyped up, juiced up. Anytime when someone says, oh, this is a very complicated process or a problem that we couldn't, resolve, I get excited. That is what I love. I love taking something that is not working and making it work. And that gives me the pleasure, the self-satisfaction that I'm so excited about. So that's something that I enjoy, solving problems.
Oh, that's so good. And see the joy in your face just even talking about it. That gets me excited and hyped up. All right, Fareed, this has been an awesome conversation. I feel like we could have part 2, part 3. This has been fantastic. Typically, we kind of end where, you get to talk about if any jobs you're opening, but we haven't talked about, you actually have a sort of another business. I think it's another business, Steward Global Consulting. Can you share a little bit about what you're up to with this endeavor?
I think it's a good segue to my previous response. I love solving problems, right? So one of the problems that we healthcare leaders had to deal with and address post-pandemic is staffing shortages. We are no different. We had situations, we still have those cases, unfortunately, where we have open positions and folks don't show up for the interviews, or they're hired and they don't show up for the orientation. And we also use other external partners and vendors and so on. No questions. But overall, inflation and staffing shortages have really caused the healthcare organizations to really, it has impacted significantly And you may be well aware, most of the organizations have reported negative bottom line. And really that did not change much, even though the volumes have been back to pandemic, but the inflation, the staffing challenges, shortages, and the increase in purchasing costs has really impacted the hospitals. So to resolve that problem, I established Steward Global Consulting. We provide top cream of the crop talent through our global talent network. And we have been able to solve the problem of obviously the inflation, as well as made sure while the cost is low, the quality is high and the transparency is something that we wanted to make sure we bring back into healthcare. I had positions in my past where I was responsible to manage the vendors and their performance for over 90 hospitals. And one of the things that I've seen and consistently focused on at that time was there was no desire to open an organization to do something. But I always thought if only we could bring transparency into the process, this would be amazing. And that's exactly what we do with Steward Global Consulting. We really engage with our clients, allow them to hire the top talent, they engage in the process, and they get the right people. And our clients are very happy and excited and satisfied with our performance so far. So I would love to share and support other organizations who may be having similar issues and problems.
And so is it just specific to healthcare? Do you work only in the healthcare industry or other industries as well?
So since healthcare is my niche, and I know the focus was not to really just, make money, but be very strategic. I know that the hospitals were struggling. So we started with healthcare, but we help in, for example, patient accounting, patient accounts payable, IT, nursing, virtual nursing. So if I really look at it, it could be any domain. It is not bound to healthcare, but I'm focused because one of my missions was always to serve and to solve problems. And this is something close to my heart. And I see all the hospitals struggling. So that's really one of the reasons why I started off, but it could be expanded to any organization, any domain. And also at the same time, I think as long as a job can be done remotely, I can support. It really is that broad.
To be honest, I haven't talked to a single person in healthcare in the last 5 years that hasn't said one of their biggest challenges is hiring labor, filling bodies in open job positions that they're just struggling to fill. So that's amazing. It's definitely needed, right? Where can listeners who want to learn more about you or Steward Global Consulting or Marshall Health Network, what's the best place to find you and where can they kind of go to learn more about what you're up to?
Absolutely. So LinkedIn would be the best place to connect with me. And obviously, I'm very passionate about what I do. It does not have to be about Steward Global Consulting. Even if you want to partner and share ideas about revenue cycle and how do we partner together and solve the problems, I would love that opportunity. I am proud to work for a great organization, Marshall Health Network. Would love to talk about Marshall Health Network as well. If you'd like to learn more about Steward Global Consulting, you could go to the website, www.stewardglobalconsult.com. And I can also be reached directly at fa@stewardglobalconsulting.com. I'm here to partner and help. It does not have to be just in a business transaction relationship, but really partnership between the hospitals to see how do we solve problems.
Awesome. Well, Fareed, thank you so much for joining the show. This has been an awesome conversation. I feel like I learned a lot. So thank you for making the time. It's been a pleasure, sir. Thank you so much.
Thank you.